Hi there, everybody. This is Carrie Hamblen, the CEO and president of the Las Cruces Green Chamber of Commerce, bringing to you again another one of our special Zoom chat series featuring our members, the Green Chamber members that are participating in Southern New Mexico Giving Day 2025. The Green Chamber, along with the Community Foundation of Southern New Mexico and the United Way of Southwest New Mexico, are partnering up to help elevate members of the Green Chamber, which are nonprofits, who are participating in Southern New Mexico Giving Day. And I have with me today Fatima McElveen, who is the psychiatric nurse practitioner for the Amador Health Center. Fatima, it is so lovely to meet you. Thank you so much for being here today.
Thank you for having me, Carrie.
You've been there. You're kind of one of the OGs. You've been there since 2015, which is a long time. It's 10 years. Congratulations
Thank
on the
you.
10 years. Yes. Can you tell us a little bit of background about Amador Health Center? Because many of us who've worked on the Community of Hope campus know it as St. Luke's. So can you kind of give us a little bit of background on moving from St. Luke's to Amador Health Center?
So yeah, I think a lot of folks still in the community recognize us as St. Luke's Healthcare Clinic. Started as a free clinic in 1990 at a local church and then moved to the Community of Hope campus. I think it was 1994.
Hmm.
First medical director who I think is still practicing is Dr. Ting, Stanislaus Ting, who's an allergist here in town. And it was ran as a free volunteer clinic up until 2015 when our former CEO, Pamela Angel, helped the clinic to become a federally qualified health center. And so we started to receive federal grants and federal funding in 2015 to expand our mission, to move our mission forward.
That's a big deal. And Pamela, as of this recording, has just recently retired, and so you've got Ron Fitzherbert, who is now the new CEO, and he has hit the ground running. So I'm grateful for him doing that. And with that, becoming a federally qualified health center, that's a big deal because of those access to those grants, but also just the services that you can provide. Can you talk about some of the services? Because the mission of Amador Health Center is providing healthcare to everyone. And really, I just love that it's a basic human right, that Amador Health Center is like, this is a basic human right that people have access to healthcare. So can you tell us about some of the programs that you offer?
Yeah, so like you just mentioned, we welcome all people. We want to care for all people from birth to, you know, if they live to be 113, just across the lifespan there. We provide primary care, behavioral health, which includes medication management and counseling services. We've also got a recovery program with harm reduction services, which includes also syringe exchange, Narcan distribution. Through those programs, we've got additional services, social services like peer support workers to help people, community health workers to help navigate the system for people and provide the resources that they may or may not know about. Um,
Well, in as you're going on, your main clientele are folks on the Community of Hope campus. So those are folks experiencing homelessness, but that's not your entire client base because anybody can go to the Amador Health Center.
right. Anybody with or without insurance, regardless of, possible legal status, if they're new to the community, if they're navigating the country from, a place of looking for new opportunities with their families because they've been displaced. We also offer care to people um, to support them in how they want to express themselves authentically. And again, we do that regardless of their ability to pay. We just want to decrease the access, or we want to increase access to healthcare and decrease the barriers. And we don't want to have to, put up more red tape for people to get care.
Right. And also looking at the bigger picture of being on the Community of Hope campus, when you talk about case management and you talk about, in terms of support groups and all of that, that's really looking at many of the factors that contribute to homelessness, that cause somebody to become homeless just because of one catastrophic event. And it could be a mental health crisis. It could be, being hospitalized and not being able to pay those bills and then losing your job and losing your home. I mean, we all, I don't think many of us take it for granted, but I think that there are many of us who don't understand how close many of us are. And so serving the unhoused community is really important as part of that overall plan to help people get back into their homes and get back on their feet.
Right. A lot of us
Mhm.
that work at Amador, we've been there for many years and we believe in the mission. We're there because of the mission. And we do understand that a lot of folks are one paycheck away from possibly being unhoused or just being in a financial situation they don't want to be. So we have to remember, like, we are the people and we want to care for the people.
Yeah, I love that we want to care for the people because it's absolutely true. Well, as we finish up today, Fatima, when you're one of many organizations. We have 25 Green Chamber members that are participating in this, and we've got Southern New Mexico Giving Day. Pre-giving starts on Monday the 21st, and the actual day of fundraising extravaganza is on Friday the 25th. And so when folks decide to give to the Amador Health Center through Southern New Mexico Giving Day, and just to stress, one of the benefits is that the Community Foundation and the United Way are finding people to help match those donations. But it's also an opportunity for Amador Health Center and all the others to really increase your awareness, or increase the community's awareness about what you do. And so if folks want to give to the Amador Health Center, how will that help you continue to do the amazing work that you're doing in terms of providing healthcare to people in the community?
Yeah, so donations help us say yes to healthcare overall. And so if people are, you know, if they agree with our mission, if they want to help us in our mission, donations help us provide gaps in care that maybe grants don't otherwise cover.
Mhm.
And it also allows us to help individuals in need. So if people believe in that, here's their chance to help us out.
That's fantastic. And there are those of us who are fortunate enough to have insurance, and then there are many people who don't. And so, being able to serve both of those communities at Amador Health Center, and I know, like, if I were to go in because I have insurance, that would help offset the costs that you all provide for those who don't. So I'm really grateful for that opportunity. So, if you'd like to help give money to the Amador Health Center, you can find them either above or below at the Southern New Mexico Giving Day.org website. That's either in there or down below, all depending on what platform that you're looking at us today. Also, pre-giving starts on Monday, the 21st, and the actual day where you should see your social media just go absolutely bonkers is on Friday, the 25th, and the Green Chamber, along with the United Way and the Community Foundation, will be doing a bunch of stuff on Friday. So I hope you'll tune in. Fatima, thank you so much for the work that you do. As the psychiatric nurse practitioner, you've got a lot on your plate, because not only are you a nurse practitioner, but you're a psychiatric nurse practitioner. So you provide multiple services, and so very grateful for that, and grateful for the work that all of you do at the Amador Health Center.
Thank you. We're happy to provide it. So thank you, Carrie.
Absolutely. Thank you. And thank you for coming. I hope you have a great week. And I hope Southern New Mexico Giving Day is a great day for you. My fingers will be crossed, and appreciate your time. So thank you so much.
And thank you, Carrie. Have a wonderful day.
You too.